This is a 55 years old male, known case of diabetes and hypertension and smoker, who presented with the typical chest pain to the emergency department with Wellens type A pattern on the ECG, and LV function is normal, was normal. No, there was no RWMI. It was fairly normal, and then he was taken for angiogram, and this is angiogram, LO caudal view with right radial root with this tiger catheter. You can see the long left main coronary artery, and you can see obvious thrombotic occlusions right from the proximal LAD, and you can see also the thrombus apparently in the Ramus also, Ramus or high OM. So in this LO caudal view, apparently you can see, we see on this RO caudal view the same thing you can see. This is the epicranial view, and the large thrombotic significant occlusion, almost subtotal occlusion, is seen in this RO cranial view also. And this is the RCA. There's a mild stenosis in the proximal RCA. So as soon as I see the Wellens pattern on the ECG, I suspect the LAD. That's a bit obvious, and you can see the high thrombus burden, and that extends to this Ramus also. So after obtaining all clearances, this patient was taken for the angioplasty. The plan is to angioplasty to LAD in the Ramus. So simply with right radial root, this is a XB 3.56 French catheter, and this is a BMW PTCA wire. It was cinched to cross the wire. There was no difficulty in crossing the wire. Only I was afraid of transfer of this thrombus into the left main. However, nothing happened. So straight away I proceeded with this stent. This is a 3.5 into 24 stent, and this is the positioning of the stent. Then stent was deployed at around 12 atmospheric pressure, 16 was RBP. This is a 3.5 stent. This was a 3.5 stent, and this was the scene after the stent. Went well. There was no slow flow, although we anticipated the slow flow, but there was no slow flow. Same thing you can appreciate in this epicranial view. Then this was a 2.75 stent, 20 in length, and it was deployed in this Ramus ostium at almost 12 atmospheric pressure. And this was the scene after the angioplasty to LAD and the Ramus. You can see T3 flow. There's no residual thrombus. Certainly you can see in this areocranial view also, there is no residual thrombus, there is no residual stenosis in this LAD and this Ramus. So this was the angioplasty in this Wellens pattern patient.